First, let's talk about obesity and why it's such a serious problem to your health. Obesity is not just extra weight. Obesity can cause serious medical conditions as a direct result of the weight. And we have a couple of different definitions of obesity and morbid obesity that are important when you're thinking about weight loss surgery. So, obesity is defined as having a body mass index of 30 to 40. Morbid obesity is defined as having a body mass index over 40. This is the point at which your weight could really become a matter of life and death. So what is body mass index? This is a term that you hear a lot lately, but you may not know what your body mass index is. It's difficult to figure out in your head because it's a complicated formula that takes into consideration your weight in kilograms divided by your height in meters. So typically you'd have to go to a website BMI calculator to figure out what your BMI is. You just plug in your weight and your height and it'll give you a number. Here's a body mass index table that you could also use to look up your BMI. We mentioned that BMI of 40 is the point at which really we see life-threatening potential medical conditions as a direct result of excess weight. But what I want you to realize is that you can't just look at a patient's weight, because if we have a patient who is on the shorter side, say 5 feet tall, and we follow this line up and over, we see that in order for them to fall on this BMI 40 line, they only have to weigh 200 pounds, which you wouldn't normally think would be a patient who has serious weight-related medical problems, but because their BMI is 40, the evidence definitely supports that this patient is at high risk. Also, having a body mass index greater than 40 significantly shortens life expectancy. Studies have shown that patients who have a BMI of 40 have a mortality ratio that's 2.5 times higher than a normal weight patient. This means that the patient is basically 2.5 more times likely to die from any cause than a normal weight patient.